In 2020, there were 2.3 million women diagnosed with breast cancer. And in Taiwan, breast cancer is also the #1 cancer incidence among women in our country. Early prevention, detection and treatment is important. Biopsy is the primary method to help diagnose breast cancer pathologically. Needle biopsy is a minimally invasive procedure to retrieve tissue samples for pathological examinations. Our research focuses on the innovation of needle designs for better biopsy outcome, for example, reduced tissue damage and pain, less complications after surgery, or better sample quality for more accurate diagnosis. The first research shown in this video is a novel needle design with double concave curved cutting edges, which is suitable for rotational needle insertion. We conducted the design of experiment method to optimize the design for minimizing the tissue fragmentation and cutting force. First, the inclination angle, rake angle, and slice-push ratio are investigated. We applied the Taguchi method to design the experiments with 5 factors. The rotational needle insertion experiment and tissue sampling experiment were established to study the effects of these factors on the cutting force and sample quality. The results showed that increasing the geometric parameter K or rotation translation ratio could significantly lower the cutting force. A larger sample could be extracted at a high rotation translation ratio or a high insertion speed, but fragmentation of sample could occur more frequently. Within the design space and experimental conditions examined in this study, the optimal configuration was K equals 0.35 with a rotational speed for lower cutting force was 30.8 revolutions per minute and K equals 0.2 with a rotational speed for minimizing tissue fragmentation was 49.29 revolutions per minute. Studies have found that bleeding and hematoma are major complications for vacuum-assisted biopsy, which could be caused by tissue damage. The common tissue damage are fluid displacement, vessel rupture, needles sever and drag the microvasculature. We established an optic experiment for the strain measurement. A high-speed camera captured the cutting process at the internal surface of specially fabricated tissue phantom. The displacement and strain fields were then calculated. The results of needle insertion with unidirectional rotation and bidirectional rotation were compared. A positive correlation between the effective strain and tissue damage has been found in literature. Therefore, in this video, we utilized DIC technique and presented how bidirectional needle rotation can help reduce the tissue damage by observing the effective strain surrounding the needle. Compared with the unidirectional rotation, applying bidirectional rotation reduced 10 to 20% of strain observed at the axial section. The switching frequency of rotation direction was an insignificant factor to the strain. Besides, the effective strain at the axial cross-section also revealed that the tissue damage increased as the needle insertion speed increased but reduced with the increase of needle rotation. For clinical applications, it would be beneficial if the rotation and insertion speed of needle can be adjusted. For high-speed needle rotation, bidirectional rotation is preferred to reduce tissue damage.